Hi all, good morning. Hope everyone is doing well. So,
Hi all, good morning everyone. I am Sara Sani, an OIT trainer from AJINORAH Institution from Kochi.
okay, so this is me, Vanda Varghese, OET trainer at Kochi. So, I know that my students are waiting for this session and it is something really requested from the students. So, let's start with a very short time. We are here waiting for our students. So, kindly join with us, and as everyone knows that this is a Q&A session. So please do kindly message if any kind of doubts or question if you have in the comment box. So we're gonna go through that and surely we're gonna answer to your questions and concerns. Okay. So the students are wishing us good morning all. Good morning everyone. Okay, so Sarah ma'am, today we are with something really different, and I was really waiting for this kind of live. Okay, this is a Q&A session. So before moving to the concerns or questions of our students, could you please tell me something really regarding what is OIT speaking? Can I get a brief idea about that?
Sure, ma'am. Yes. So most of our students want to know more about the speaking. Actually, it is one of the flexible module in OET exam, and which is having a warm-up question to comfort the candidate and to know each other's voice. So there will be an interlocutor as well as a nurse. So and time is like 3 minutes for the preparation and continuous 5 minutes for the speaking. And also, it does not have a constructed answers, but there are certain things to be followed. Ma'am, do you have any idea about that?
Yeah, sure, I have an idea about that. Like from the orientation or from the beginning itself, we are teaching you regarding this about the criteria. Okay, so maybe you do have a confusion why we are learning about the criteria. Let me tell you one thing, that as Sarah ma'am mentioned, it is one of the very flexible module in OET. Okay, there is no any kind of structured answer for this. Okay, keep in mind. But you have to follow certain things in this OET speaking, then only you will get the required score to pass your OET exam, OET speaking examination, and that is all about the criteria. Okay, so I'm not going to be so detailed about it because I know that it is something really boring as well, and here we are going to discuss about your questions and concerns. Okay, so let me tell you very briefly what are the criteria or what is actually meant by the criteria. Okay, we have two criteria in OET speaking. The first one is linguistic criteria and the second one is clinical communication criteria. Okay, so linguistic criteria, it is to assess your language or your English speaking skill. Okay, and clinical communication criteria, it is to assess how you are able to communicate in a clinical setting. Okay, is that clear now? Okay, so both completely, I can tell you one thing, that they are actually assessing how you are able to communicate in a clinical setting with your language or with your English. There is no any structured answer for this, but you have to meet these kind of things in your role play. Then you will get your required score for your examination.
Okay, ma'am.
Okay, so yes, the students are joining, and wish you very good morning for everyone. So as we mentioned, yeah, it is something really special with the OET speaking. So I'm requesting all of our students to kindly take a note and pen and just note on what we are discussing today, because it is something kind of very general question or very general concerns and doubts of yours. So you can point out this and take the notes, and surely it will be helpful for you.
Yes.
Okay. So Sarah ma'am, shall we start?
Sure, ma'am.
Okay, so without any delay, let's start. So okay, I'm giving this opportunity for her to begin the question and concerns to sort out for our students actually.
All right. So thank you, ma'am. So most of our students having the concern regarding the role play card, like who is going to initiate the role play. There is a dilemma that the interlocutor may or may not. Ma'am, could you please explain regarding that?
Yes, it is a very concern from the student or question from the students. Actually, they do have a doubt who gonna initiate that or how to find out. They always be in the role play. They are actually being kind of, should I start or should ma'am ask question? Okay, so fine. Okay, let me cite an example right over here. Okay, so shall I cite, say, cue card over here?
Sure.
Okay, so just think that, okay, this is a setting, an emergency department. A mother came along with her son. Son is having nose bleeding. Okay, and your first task, okay, this is all about the background. Okay, your first task is to find out reason for the visit. Second task, explain the management. Third task, advise about nutritional diet for the baby or for the child. Okay, so these are the 3 tasks in the role play. Okay, yeah, so second task was explain about the management. Third task was something really about the nutrition. Do you find any connection between these 2 tasks?
Yes, ma'am, actually.
Yes, so there is a connection, but we do have a, like, when we are asking the second when we are doing the second rule task, we completed it. If you do have a confusion, obviously in the cue card there is it's a kind of a script, but it is not the answer of the second question. Third is something really different. Okay, so if you have a confusion with how to do that, or should I ask a question or should she ask a question, whatever it is, just ask a question in between the task. Do you have any concern, or do you have any question, or do you have any queries? Okay, surely keep in mind all the task is not to be initiated from your side. Okay, there are questions from the patient or the bystander, and there are answers in your cue card. Okay, so they're going to tell you, so there is a 2 possibility. They're going to tell you, yes, I just want to know about some kind of tips regarding to improve his health status. So can I get some kind of advice from the from your side about the nutrition? Now we got a link, we can answer that, the third question. Or if they are telling that, no, I don't have any doubt, fine. Okay, now the goal is in your post. Okay, you can simply ask a permission. May I know about the diet of your child for getting a better picture of his health status? Then they're gonna tell you something about it. Then you can give an advice. So this is a clear way of constructing your cue card. Okay, if you didn't get a clarity who gonna initiate that, just ask a question in between the task. Do you have any concerns? Do you have any queries? Is there anything to be clarified from my side? Yes. Okay, and according to their response, go for your next task. Okay, I think that it is clear to them. Okay, so shall I ask one another question from the students? I think it is clear for you guys. Okay, the students are joining with us. So kindly repeating you once again. So kindly take a note and follow the things which we are explaining or we are discussing today. And kindly feel free to ask the questions in the comment box so we can go through it. Okay, so Sarah, let me ask you one doubt from my students.
Yes, ma'am.
Okay, so always the second one is that how to find out non-case and unknown case from a cue card. Always there is a confusion. Okay, so do you have any tips over there?
Actually, yeah, that is a repeated concern from the students. So if we are getting a cue card, we have to look on to the setting initially and background and also the first task. So keep in mind these 3 points are to be followed every time when we get a cue card.
Yes. So as ma'am said, we have to take 3 things in consideration. First one is setting, background and task. Okay, see, always what the students are doing now, see, if they are actually saying that it is emergency department, they are actually fixing that it is unknown case. Not really. Okay, you have to go very thoroughly with the background and the first task and finalize whether it is non-case or unknown case. But I can tell you one thing, that home visit is always non-case. Okay, but see, let me give a clarification regarding what is non-case first. Okay, you don't want to know the patient very closely, or it doesn't mean that, okay, you know the patient before. Is there any possibility to know whom you are talking with? It is non-case. Okay, maybe the patient for in a clinic or community health center, the patient came to receive the investigation report. Okay, so maybe you're gonna see the patient for the first time, but he or she is there to collect the investigation report. Surely in that investigation report there will be the name of your patient. Okay, so is there any possibility to know the name of the person whom you are talking with? It is non-case. Okay, which means during the 3 months preparation time, you must ask the name of the patient or the bystander to communicate. I think it is clear right now.
Yeah, hope everyone has cleared now.
Okay, so yeah, the next one is about the sentence construction actually. Okay, so ma'am, can you give some tips to sort out this problem of my students, how to bring good sentence construction, or how to avoid, or how to avoid this grammatical errors in the speaking?
So regarding the sentence construction, we need to learn some connecting words, such as and, then, following, initially. According to the task, we can connect words and complete a sentence.
Okay, so do you have any kind of, actually you just mentioned about there are some kind of words, right?
Yes.
So can you list 1 or 2 words for our students to improve the sentence construction? So here we have noted all these kind of things. So can you read this for our students?
Sure, ma'am. So some words like and, then, following, initially, finally, as I said.
Okay.
Yeah.
So thank you so much, ma'am. Actually, these are some words. See, actually, this problem is actually always. I'm repeating the word. Actually, I'm sorry for it. Okay. Always coming in explanation task. Okay. In explanation task, it in bracket will be given if any kind of procedure or post-operative procedure, any kind of procedures, they will be given in bracket. Observation for 24 hours, pain like consultation by doctor. Then after a coma, they will be given shifting to post-operative ward. Okay, so you don't want to like create the sentence in your understanding level. That's a problem actually always going through this. Okay, what you have to do is, if you have a problem with the sentence construction, what you have to do is, as ma'am mentioned, just add on this and then. Okay, if what example I just mentioned, you can go through like this. After surgery, you will be in observation for 24 hours and doctor will come and consult you, then you will be shifted to post-operative one. Fine. Okay, you don't want to create that in your understanding level. If you are confident to do, totally fine, you can do that. But if you don't have the confidence, this is a very simplest way to solve this. Okay, shall I repeat that once again, because they can note this? Okay, yes. So for that you can note these kind of words. I'm repeating to take the notes. Okay, and, then, following, initially, as I said. Okay, so these are the 1 or 2 words you can add on to improve. And some kind of procedures. Okay, if any kind of step-by-step procedures, you can add on firstly, secondly, at last, or finally. It will be also good to improve the sentence construction. Okay, so that is a tip for that, or that is a way to sort out this. Okay, so yeah, this is something really interesting next. Okay, how can we bring different introduction to different scenarios? Okay, so it is always we have gone through this topic as one single live, so you can refer that if you want, but I'm just giving as a note right over here. So ma'am, can you just give me some tip or some way to introduce in home visit?
So in the home visit, we can ask isn't it Mr. John's? For example, isn't it Mr. John's house? Am I talking to Mr. John? Is this the right time to speak to you? Is that okay, ma'am?
Yeah, that's perfectly fine. See, always the students are asking, am I talking to Peter? See, even though it is a non-case, it is home, and yeah, there is a possibility to get to have a conversation with another one. So for that, you can ask, am I talking to Peter? Okay, you don't want to repeat the question again and again. Okay, always try to show the questions. Okay, the students are asking like this. Okay, is this Peter's house? Am I talking to Peter? Is this the right time to talk with you? May I get in? Okay. It is not wrong, but see, when we are taking the cue card, no, we gonna feel that you are simply dragging the conversation. So don't try to do that. Okay. So you can simply go with, as ma'am mentioned, am I talking to Peter? And second one, just mention the reason of your visit. Mention. If it is always better to mention the reason. Okay. Mention the reason for the visit. Plus ask a question, is this the right time to talk with you? Okay. Then this is a perfect way of beginning. Okay. So before that, you have to, for home visit, for sure, you have to greet the patient. Then go for your introduction. Okay, I'm Varna Varghese. I'm a community nurse working. I'm a registered nurse working in the community health center. Whatever it is, just mention. So just introduce yourself. Then go for what we just mentioned over here. Am I talking to Peter? Mention the purpose. Plus, is this the right time to talk with you? Okay. If it is hospital ward. Okay. If it is hospital ward, just. Okay, if it is non-case, a patient, it's a second day of the surgery. Okay, surely it is a perfectly non-case, right? And you don't want to tell the patient that I'm one of the registered nurses. Okay, because it is actually, you know the patient, and the patient also know that you are a saint nurse. Okay, or you are a registered nurse. Okay, and it is hospital ward, and it is a non-case, and the patient is there for the last 2 days, right? So always go with a very friendly way of approach. Okay, normally when we are entering the patient's ward or patient's room, we're gonna ask, have you had your breakfast? Are you have your food? How was your sleep yesterday? How was the day going? How are you feeling right now? Totally fine. You can ask these kind of questions. Don't want to ask all the questions. Any one of the question will be so friendly for having the conversation. Okay, so we can begin like this. Very good morning, Peter. Always try to mention the name, because hospital ward, always better to mention that. Okay, for a hospital ward non-case. Okay, very good morning, Peter. As you know, I'm your caring nurse. I'm Varna. Or hope you remember me. I'm your nurse, or I'm your caring nurse. I'm Varna. Okay, so you completed your introduction. So before beginning your first task, just ask a question. Is this right? How was your day so far? Or how are you doing right now? Then go for your task. That's a very good way of communication in the non-case in hospital ward. Okay. So what about emergency department, ma'am? Kind of, it's just if it is unknown case. If it is unknown case in the emergency department, how can we start our introduction then?
So we can start with the greeting actually.
Okay.
So we can start with good morning. May I know your name, please?
Okay.
And we can ask the reason. May I know the reason behind your visit? So this way we can start in an emergency setting if the case is unknown.
Okay. So as ma'am just mentioned, just note it down. Okay. And Christina, she asked in case of clinic. Okay. So in case of clinic, so we have to take in consideration whether it is a non-case or a non-case, then plan accordingly. If it is clinic or there is a possibility of being unknown or non, so both. Okay, so plan accordingly, go for introduction, go for greeting, your introduction, and go for your first task. Okay, so before that you have to make sure that whether it is a non-case, because clinic is always in a confusing setting, that whether it is non or unknown. Okay. Then one thing I just want to mention, yeah, that's about the clinic, and we have go through all the settings, right? So anything else? Home visit, emergency, clinic. Okay. I just want to mention something, but I forget. When I'm remembering, I'm sure I go through that. Okay. So this is all about. Okay, I got it. Okay, just examined or observed case. Okay, so just examined or observed case. May I ask a question? Do we want to introduce ourselves in just examined case?
No, ma'am. So there we can start with thank you for assessing your wound or whatever. According to the scenario, we can tell thank you for the examination or thank you for the assessment.
Okay, so this is actually that's a task is from halfway of conversation beginning. Okay, so keep in mind, so already you introduce, you ask the permission for the observation, or you are for kind of examination, then you are saying thank you and you are continuing. So it's a kind of halfway beginning task. Okay, and here school nurse, they are asking about school nurse. Okay, fine. For school nurse, actually there is high possibility of knowing the name of our patient, or because there is a high possibility of having a conversation with him. As ma'am mentioned, it is about the parents. Okay.
Yes.
Okay, so and there will be name mentioned, or there will be we have a QCA that is about the BMI. Okay, so it's for report the child is overweight or something, and it's above the BMI level. So there is a chance of knowing the student, because we observed him and we know that he or the student is, or the student is actually it's above the BMI level. So you can go for as non, and you can introduce yourself as a school health nurse.
Yes.
Okay, greeting, your introduction, and go forth as a kind of non-case. Not always, if there will be hints given, just examined, just observed, or kind of. Okay. Okay, in emergency ward and okay.
In emergency ward and emergency situation, how can we introduce them?
Okay, Swati Krishna, I don't know. Actually, she is mentioning about the thing. See, the students, when they are taking the class, they will ask to me, ma'am, shall we go for the, see, if it is bleeding or something, instead of in their normal settings, when we are thinking very naturally, we're going to feel the same. Okay, shall we ask the reason? Because it is bleeding, instead of introducing and greeting ourselves. Okay, fine. Shall we go for the reason first, and shall we ask the name of the patient next, and third time we can introduce. Totally fine, it is not wrong. Okay, but the thing is, when you are having the conversation, if you want in the emergency department, according to the situation, according to the seriousness of the situation, if you want, you can ask, okay, it seems to be really worried, may I know the reason? Or after greeting, good morning, okay, you seems to be really worried, may I know the reason? So they're gonna tell you what the reason for the visit, and you can ask the name of them, and you can introduce yourself. Totally fine, but always have a confidence that you will not miss your introduction and your introduction. There is a high possibility of missing it. Okay, because it's a kind of a conversation, and you're gonna have the replay and response kind of things, and you're gonna miss that sometimes. So totally fine, you can handle accordingly. Okay, and
so
can you please restate the 3 tasks in the speaking? I think Elizabeth is asking for the 3 tasks in the speaking. I don't know what she is mentioned. Okay, maybe it will be like things, hospital, that emergency department, mother came along with the son about the nose bleeding. I mentioned about the 3 tasks. First one, find out the reason for the visit. Second one, explain the management. Third one, advice about nutritional diet. These are the 3 tasks I mentioned. I don't know, Elizabeth, I have you asked for this, but I'm explaining that for once again. Okay, so ma'am, see, I think she is asking for the same. Okay, so can you add on thing, how can we bring the conversation into normal? If it is explain the management, and the third one is advice nutrition, there is no any connection between the 2 tasks. Okay, so how can we handle that?
We can ask the concerns. Do you have any concern, or is there anything to ask? Such questions.
Okay, so we can ask about that kind of things. Okay, can you read the can you read some kind of follow-up question for our students, so we can keep the note over here. So there are some kind of follow-up questions, so you can go through that.
Yeah. So this is okay, so we can tell, like, I can understand your condition, or I do understand, I can sense your emotion, I can sense your feeling, your concerns are understandable, your concerns are reasonable. That is according to the situation actually.
So these are actually some reassurance. Always they are telling me, I can understand your concerns and kind of. So follow-up question, is that clear to you? Are you following me? Are you in the same page? So these are some kind of understanding and follow-up question. I will give the explanation later on after completing the concerns which is in the comment box. Okay, and they are asking, in case of reluctant patient. Okay, in case of reluctant patient, how to handle it? maybe it will be like, okay. So Sarah ma'am, do you have any tips for them how to handle the reluctant patient?
So for the reluctant patient, we have to continuously console the patient or continuously reassure the patient. As we have already said that we can always tell, I can understand, so I can understand your situation, or I can sense your feeling. So here, according to the task, same as Varna ma'am have mentioned before, we can explain that the follow up, the reassurance continuously we can applicable.
Okay, so try to give the see, one thing is there is two type of reluctant patient. One reluctant patient, like one set of patient will be, they're gonna agree with you reluctantly, they will agree with you at the end of your conversation. Okay, and some patient they will be reluctant throughout. So what are the effort you are putting, there will not be any kind of positive words from their side. So totally fine. As ma'am mentioned, just try to reassure and try to console it. Okay, and one thing keep in mind, in your task always it will be like this, in the task it will be like this: advice about nutrition, advice about how to stop the smoking habit. Okay, and you are giving advice, and I'm gonna tell you, no, I don't want to stop the smoking habit. Again, you are telling some kind of a reassurance, and you are adding some kind of things.
Points.
Okay, and you are trying to encourage me, but I'm answering that reluctantly. I don't want to follow your words. Again, you are trying. Okay, and you will be panic. Okay, my time is running, I cannot complete the task. Keep in mind that it is reluctant patient. Okay, in the task it is given as encourage the patient. Okay, that's your task. You are giving encouragement plus the reassurance, you are supporting the patient. Okay, for the patient, they don't want to be encouraged. It's all up to them. We are nurses and we are advising, so it's their priority, it's their right. They can accept or they can reject.
Yes ma'am, that's what we cannot compel the patient. We can try our maximum to change their habit.
Okay. Okay, so I think that it is clear to them how in case of reluctant patient, this is a way of handling. Try for first time, they're gonna oppose your statement one more time. Okay, then jump the task. I'm not telling it is to skip. Okay, just jump the task, go for your next task. Okay, then at the end of your task, just add on this thing. Okay, Pete, if they haven't taken your words in a valid sense, okay, you just add on like this. Okay, Peter, I can truly understand your situation. I hope that you need some time to take right decision. So I really wish for your right decision. So wish you a good day.
Yeah,
fine. We are leaving the room, or we are leaving the place.
Conclude the task.
Okay, this is a way of and if you want, you can mention once again. So as a caring nurse, I'm just telling you once again about the smoking cessation and about so and so. So I hope that you will surely gonna take my words in a valid sense. So wish you a really good day. So now you're gonna wind up the task in a very good way and sensible way. So no need of making so tensed about it. Okay, so
ma'am, we have a question that introduction for occupational setting like industrial workplaces.
Okay, so industrial workplace and school health. Okay, it is actually kind of same. In industrial workplace, there is a possibility of getting a regular checkup or something. Okay, so you can just tell that I'm a registered nurse, or my name is kind of just examine case. Okay, as ma'am mentioned, you can start by thank you for allowing me to assess, or if it is not examined, you are occupational nurse, patient came there for checking, go for the regular assessment or regular kind of treatment or investigation, whatever it is. Okay, and your if it is non kind of same, go for introduction and just start with a very friendly conversation. If it is unknown, you can say that very good morning, I am a registered nurse. For better communication, may I know your name please, and plan accordingly. So just go with the task. Okay, the first thing, just learn a very common or very clear picture regarding what is non-case and the unknown case, and learn an introduction for non and unknown, for clinic, for school health, as well as for occupation. For these three settings, you can go for the same introduction. For non and unknown, learn that separately. Okay, then in emergency non case, how to introduce. Okay, so what else? See, whatever the setting, if it is known or unknown, just
We can ask the name actually.
Yeah.
For the better communication, could you please restate your name?
Yeah.
So
Okay.
such a way we can ask the name.
If it is emergency and you know the patient before, or if there is a cue card in our AJINORAH, that is patient, we know the patient 20 years. So far of 20 years, we know the patient, and he or she came there for smoking cessation, getting some kind of advice for the smoking cessation, because he is having a baby right now. Kind of a scenario is there. So already 20 years, you know the patient. And okay, it's a perfectly non-case. For that, you can begin a very differently way. And so you can start with, okay, Peter, it's really good to meet you. But actually, there is a positive way of approach, because the patient came there by himself to get some advice to stop the smoking habit. So in that way, I'm really good to meet you. Okay. Otherwise, in the emergency department or hospital never say that really good to meet you, because it's something really worrying situation, and it is not very fair for if you are starting with good to meet you. Okay. And yeah, we don't have to introduce ourselves at emergency non-case.
We don't have to introduce
We
ourselves.
have to introduce ourselves, because otherwise they don't know whom they are talking with. At least
First
you
of all,
have
the setting is emergency, entirely a different setting actually.
So they have to, for making them comfortable, for making a good relationship building, it is really important to introduce. If it is something really serious, as I mentioned, if it is something really serious, you can ask like this. You can ask for the reason for the visit, then you can introduce. But it is really important, you must introduce yourself. Okay. Otherwise, in relationship building, I don't think that it will be meeting. Okay. So it's about voice modulation.
Yeah, voice modulation.
Okay, ma'am, just go through this. Emil, I think, yeah. Emil. Not only Emil, like we have taken the concerns as a list, so it is one of the very common concern, what to do with. Okay, so can you add something? Because I'm having the conversation for the last long minute. So can you take on this?
So regarding the voice modulation, actually we are not telling we need voice modulation continuously the task. According, if the patient is reluctant, we can use our low tone voice.
Yeah.
Hope you understood, right?
Yes, I understood. Okay. Let me add you one thing that for the students, okay, because they are really when they are getting correction, voice modulation. Actually, let me tell you one thing. Throughout role play, you don't want to bring any voice modulation. Okay. If you're giving any advice, or if you're giving any explanation, do you want any voice modulation over there?
For the explanation, there won't be a voice modulation.
Same. You don't want to see, you are explaining, which means you are educating, you are giving information. It should be in a very normal way. Okay. But when you are giving reassurance, surely reassurance that will be, for me, I do have a concern. I am really worried about something. It is something a really sad or something worrying situation. And you are giving reassurance. For that, as ma'am mentioned, kind of a very soft touch. Okay. Kind of.
It's a low tone voice actually.
Lot on voice. Okay, you can say that. Okay, Sarah, I can really understand your concerns. Kind of in a very soft touch should be. Kind of instead of saying, Sarah, I can really understand your concern. That's a kind of way of explanation, very normally. Okay, but for reassurance, just bring some a low tone or kind of a very soft touch. Okay, and if it is something really happy, the patient cured and patient is getting discharged, some kind of a happy thing. Okay, so it will be what? It will be in a kind of a pitch, not kind of very high pitch, but in a very pleasant way. So will be
see.
Yeah.
I'm so glad to inform you that, or I'm happy to tell you that in such a way actually.
Okay, so this is a way of voice modulation. So keep in mind, throughout role play, you don't want to bring voice modulation. According to the situation, some kind of ups and downs in your voice. Okay, that is voice modulation. I think that it is clear for my students. Okay.
We have got a question like, can you please list out some follow-up questions? I
Yeah,
think we have
surely.
already mentioned, but again we will repeat it.
We will repeat that for your for taking as a note. So let me read that. So there is n number of follow-up question, but always they are asking what Are you getting me? Are in the same page kind of things. Okay, but let me give you some kind of follow-up question right now. Okay, you just take your note and write down that. Okay. Okay, so you can go for a follow-up question as yeah, are you able to follow my points?
Am I clear to you? Are you on the same page? Are you with me so far? And there are many other follow-up questions.
Did you get my point? Do you have any other concerns?
Further clarification. Do you need any further clarification?
Thank you for ventilating. You see, if they are telling any kind of concern, they are like kind of they are taking that initiative to give that point kind of I do have pain kind of things. Okay, so you can say that thank you for ventilating your feelings. Okay, it is not a follow-up question, but it is a kind of a response. Okay, but it is not seems to be reassurance, but not follow-up question. But I just added on it. Okay, so are you clear with that, or do you have any more doubts to be clarified? Okay, so these are the some follow-up questions. Okay, so I think that it is clear
And
to them.
yeah, we have another questions like how to start the task, like establish, find, assess and reassure.
Okay, so the thing, let me go through this. How to start?
Establish, task like establish, find, assess and reassure.
Okay, I just allowed that question because I just want to explain that about that. We were planning about that actually. Okay, see, reassure. Do you want to add on about something really? Then I will add my points about this, about reassure.
We can say I will make sure. We can add such a point.
If it is the task, reassure about what post-operative care. Okay, that is your task. Okay, I have already mentioned all the things is not your question, or all the tasks you don't want to be initiated. If it is reassure, surely there will be a question from your patient. Okay, so let them ask that. Okay, instead of giving, okay, I just want to give a reassurance. Okay, let them ask the concern, or just let them reveal the concern. So you don't want to learn anything more, just ask a question. Do you have any concern? So they're gonna ask you, they're gonna tell you the concern, and you can give the answer about this post-operative, whatever it is. Okay, so that's a way of performing reassure. Reassure is not to be initiated from your side. It is actually leaded by them, and you are continuing it. Reassure task. Okay, and sometimes if it is third task, it is given as reassure. Sometimes second task, at the end of the second task, they will be given find out any concern. So you can ask a concern, and now it is in a clear way of clear kind of conversation. If it is not, you must ask a question from your side. Okay, and yeah, next is about what?
Repeat, ma'am, can you please repeat that conclusion sentence in reluctant patient?
Yeah, sure, I will repeat that. Before that, let me wind up the concern or the question from the student. Okay, establish and find. Okay, establish and find actually kind of same. Okay, but according to the task, most of the tasks find it is actually seen as the first in the cue card. Okay, so if it is not, if it is unknown, find out the reason for the visit, or find out what happened to the patient, or find out how it happened, or find out the pain level. Okay, so we can simply start with, how can we start with find out? How can we start with? If it is unknown, find out the reason for the visit. Okay,
we can ask, if you don't mind, could you please tell more about the condition? That is according to the task actually.
Okay, so find out, you can ask, may I know the reason please, or how can I help you today, what brings you here today, what bothers you. Okay, so how can I assist you, whatever it is, or from your facial expression, or from your from my observation, it is really clear that you are really concerned about something. May I know the reason please. Okay, so you got 10 number of questions, no? So just ask any one question and you are getting the answer, then continue your task. Establish is kind of the same, but here if it is confirm, see, find out reason for the visit and confirm reason for the visit, in bracket it is given as what? Staple removal. Okay, confirm reason for visit, in brackets it is given as staple removal. So how can we start that task?
So regarding that, we can start like, if I'm not wrong, you are Mr. Peter and you are here for the staple removal. Am I right?
Perfect. Yeah, simply perfect. Okay. See, otherwise they have given the reason in the brackets. Okay. So we can ask, okay, are you here for this? Okay. So it is a better way of starting that. Okay. So I think that I have given the clarification regarding.
Yeah.
Okay. Regarding that. Okay. Then can you repeat the conclusion sentence? Okay. Reluctant patient. Okay. See, after completing your entire task, if the patient is again reluctant, you can just conclude it. Just mention, when I do the role play, I always try to mention the name of the patient, because it is a very good way of communication. So try to mention the name in between of your patient. Okay, so you can start with, okay, okay Peter, I can truly understand your situation, but I really wish that, or I really hope that you are going to take a right decision later. So right now I'm leaving from the room. I really wish you will inform, or you will take a right decision. Wish you a good day. Okay, so actually I know that I have altered the sentence. It is something really different. Okay, so you can just plan the content of this. Okay, you really hope that the patient will take right decision later. So and I really wish for that. So thank you for your valuable time, or thank you, wish you a really good day, whatever it is. Just give the conclusion accordingly and wind up your task. Okay, by wishing, he or she gonna take your points in a valid sense, or he or she gonna accept your points later on. Okay.
And we have a question like, ma'am, please give some assurance and reassurance phrases.
I think that we have repeated that again and again.
Yeah.
Okay. Let me check that, and then I will give you some kind of notes about that. Okay. So okay, I'm just listing 5 follow-up and 5 reassurance right now, and it's actually repeating that again and again. But just for the last, I'm repeating because I know that it is really important for you, so you can just go through it. Okay. What? I can sense your feeling. Okay, please put your mind. Okay, this is actually reassurance. Okay, I can sense your feeling. Please put your mind at ease and try not to worry. Okay, then please don't let it worry you. Okay, always here try not to worry. Also a kind of altered sentence. You can say that please don't let it worry you. Okay, your concerns are rational. Then thank you for being honest. See, I will tell about the scenario. If you are asking for how long you have been started the cigarette smoking or something, and the patient is telling, it's been since 2018 or whatever it is, they are telling about it very genuinely or honestly. So you can tell about thank you for being honest. Then what, ma'am, would you like to add?
If the patient is really anxious or tensed, and they are explaining, we can say it sounds really stressful, or it's so sad to hear that. We can add like that, right?
Okay, so can you give some kind of follow-up question for our students?
Yeah, so we can ask, do you have any concern? Is there anything to ask? Can you did you take, that is according to the task. If the patient needs to take the medication, we can ask, did you take the adequate amount of the medication, or the family?
Okay, so yeah, so these are some kind of follow-up and reassurance that to be included in the, not to be just, it is something really different as so far of your following. Okay, so this is how can I help you, or is anything to be solved right over now? Okay, whatever it is. So these are some kind of follow-up question and reassurance. Okay, so let me read. Okay, ma'am, here one question is, if interlocutors skip a task, how to continue?
So if we needs to listen to the interlocutor first, and we needs to answer according to the interlocutor's questions, and we can continue that.
Yes, exactly. Okay, see, maybe they haven't skipped. Sometimes in the cue card, your third task will be their second task. Okay, and you are asking, may I know the concerns, or may I know, do you have any concern? They're gonna tell about the third task of yours. Okay, so fine, don't be panic over there. Okay, fine, you are patient, ask a question, right? Just answer to their question. It will be your third. Okay, you haven't performed the second. Just answer to their question. Okay, and after making it clear to them, go for your second task. Okay, then go for your fourth one. If you have again a bothering, okay, I have disorganized a task, you do have one more tip. Just answer to your the question, that is, after your one, you have gone through the third one, and go for your second one. After completing the second one, just mention the third and go for your fourth. Don't want to ask anything about the third one. Kind of, if it's a kind of advice daily exercise, or advise some exercise methods. Okay, you answered that, and your second task is about the nutrition. Okay, you asked about the nutrition, and you can add, okay, Peter, we already discussed about the exercise, now let me ask. Okay, or now let me discuss, let's discuss about. You can go for your fourth one. Now there is a perfect organization in your task. Okay, so don't be panic, just answer to your patient, or just answer to your interlocutor, and take their concerns in a valid sense. That's it. Okay,
So we have a question. How will introduce an accident and emergency department? We have already mentioned.
Okay, so
ma'am, in examined case, no need to introduce ourselves.
no need actually. I just mentioned about that. We just mentioned about that. It is halfway conversation. Okay, you introduced. You ask permission for examination, you examine the patient, then you are beginning your task again, your conversation again. So halfway beginning, so you can start with thank you for allowing me to assess or something. Okay. How to conclude the task at the end part. So, can you give some kind of tips over there?
We can tell the patients like thank you for allowing me, or thank you for your time, thank you for the cooperation. Such things, right?
Yes, but see, if the time is up, 5 minutes, your time up, but you couldn't complete your task, how to conclude it? Okay, it is kind of, it should be, I always, when I'm taking the class, I will tell me, it is a kind of a box, kind of you begin and you are ending. Okay, so you no need of saying anything, you just say thank you, that's it. Okay, because if the time is up, they are telling, your interlocutors are telling that your time up. Okay, don't be panic over there. Okay, see, if you couldn't complete, let me go through that also. Ma'am, is there any problem if they haven't completed the task?
No.
Not really. Okay, see, task completion is actually coming under providing structure criteria, and for that they are putting score out of 3. Okay, so far of your performance was so professional and you met all the criteria, surely you will pass your exam. But always try to complete that, but don't be rushed to complete it, because you're gonna miss the task. Sometimes you're gonna miss the follow-up question, you're gonna miss the voice modulation. So better to go with the professional conversation, and if the time is up, you couldn't complete, just say thank you for your time, or thank you for the for being with me, or thank you for the cooperation. Just wind it. No more explanation anymore. Okay, and before concluding, if it is a very normal way, you can say, do you have any more? You can just ask, do you have any concerns or do you have any questions? And they're going to tell you, no, I don't have any concerns or questions. Just, and they thank, as ma'am mentioned, thank you, just say thank you and wind up your task. But if you want, you can add very naturally, I really wish a speedy recovery and I really wish a good healthy life later on. Kind of totally fine for that. Okay.
So we have a question regarding, can you please tell how to avoid humming?
Okay.
Many of our students are asking the same question.
Okay. I'm asking you the same, how to avoid humming?
So we need to continuously speak actually. If we speak continuously, there won't be a humming, I think.
Yes.
Yeah.
Okay. As ma'am mentioned, see, actually in the role play, it is a kind of extra or out of that. Okay, so you have to surely practice for speaking. Yes, it is tough to bring that in your mind, it will be, but you are not able to bring that into words. That's a problem, and that gap is filled up with this kind of sounds. Okay, that's the kind of humming sounds. Okay, so what you have to do is, first thing, try to practice individually some kind of speaking practice. It can be mirror exercise if you're, or some kind of conversation with your friends, or just try to improve that. Okay, but when you're doing the role play, okay, no one is asking you to bring back to back sentence. Okay, just give a pause, make sure that they are actually understanding what you're trying to convey. It is totally or perfectly fine for it. Okay, so just give a pause. Okay, take the next think about the next sentence and go for your next words. Okay, and when it's actually about the speed, okay, you're trying to bring that in a very back to back way. That's why, and that you are not able to bring in there that speedy way, and you are getting humming. Okay, fine, take your time, construct the sentence, go for it. Okay, and I'm not telling to give a very long pause, but in a very short pauses, totally fine. Okay.
And when I ask concerns in between the task, regarding the concerns,
I didn't get that. When I ask in between, okay.
When I ask concerns in between the task.
Okay, in between the task. When do we have? Well, you have to ask a question, right? I think that
we have already told.
We have already mentioned. That is, if you didn't get any continuation between the tasks. Okay, maybe the one task is about advanced nutrition diet. Second task is about explain daily dressing. Okay, is there any continuation between these two tasks? Not really. Okay, so you can ask the question, do you have any concern? For making that connection, you can ask a question, do you have any concerns or do you have any doubt? So they're going to tell you, or they're going to ask you, I just want to know about the daily dressing or the steps of daily dressing. And again, and they are telling that, okay, no, I don't have any concern. Fine, you just add on like this. Okay, Peter, I just want to know, do you know anything about dressing, or do you know how to do the dressing? They're going to tell you yes or no. Surely they're going to tell you no. Okay, so you can add on. Sure, okay, fine, let me tell some kind of things about it. And if they're telling about yes, okay, fine, that's really appreciable, but let me add some points from my side for preventing the complication or the further things. Okay, so ma'am,
okay, we have a question. What to do to make the communication more natural?
Okay, what to do?
Do not imitate, actually. Is that right?
Yes.
Most of us will try to imitate like foreigners. Actually, do not imitate, but we needs to know that fluency and accent, but never imitate. And the natural, we needs to speak like our own.
Okay. See, when you are preparing the task, when you are doing the task, what you have to do is always, I'm sure, I don't know whether you're going to agree with it, but most of the time just think about this. Are you doing this or that? Okay, most of the time they're going to read the task and they know how to, they are understanding the meaning. Okay, most of the time during the 3 months preparation, they are simply reading the task, setting, and they just randomly going to the background and they are reading the task. Okay, but instead of that, you just understand the situation. Okay, you just understand the scenario, just understand the situation and try to bring the conversation. See, I just mentioned about this, no, kind of a mother in the initial time, in the beginning of our life. I just mentioned about the mother present along with the son, and son is having nose bleeding. Okay, so kind of things. Okay, and the mother is telling you that okay, I'm really concerned about my son is having bleeding, I don't know what to do. Okay, this was the response of your mother. So as a nurse, it is not about the OET. It is not about the OET. If it is in the clinical setting, or if it is actually very really in your emergency department, Sarah ma'am, how will you deal? Just think, I'm the mother. Okay, I'm here with my son. Okay, just forget about OET, forget about the reassurance and kind of things. How you will manage the situation?
I'll tell to the mother that being a mother, I can really understand your situation. Nothing to worry in that. We will be taking care of your kid.
Okay, fine. See, here being a mother, okay, it is not given as a follow question or reassurance. Okay, so that was so natural. Just listen them very carefully and go with that conversation in that flow. Okay, then it will be kind of, instead of worrying how to complete the task, just change your perspective in speaking. How can you manage your patient in that situation? Then try to give your best as a nurse. Okay, then I think that it will be workful.
Yeah, actually we have to think of the real scenario of the setting, or if the scenario is in the reality, how we will deal that.
Okay. Okay, how can face the task? Okay, so ma'am, are you guys
going to it? Okay, so the next question is, can we stop the role play if the time is up, or should we continue the role play until the completion of given task?
Okay, can you give some kind of tips for them?
So we have already mentioned that if the time is up, you can say thank you, or say thank you for the cooperation, and we can leave the room. And if we having still the time, summarize the content, summarize the task, and conclude it.
Okay, so we continue the role play until the completion of the. Okay,
Same.
she mentioned about it, no? So see, actually, in the beginning, I just mentioned how you are able to manage the situation with your language. That's only actually OET speaking.
Yeah.
It is not about the completion of the task. Yes, you want to complete. It is your question paper, but don't rush to complete it. Okay, there is a patient.
Do not rush and do not drag. Actually,
yes. Okay, so just make it as kind of your patient, you want to make them understanding about what you are trying to convey. Okay, then it is perfectly fine. Okay, if one RN met an accident, how can okay, so we have just mentioned about the introductions. Okay, can we ask the name of patient at beginning of preparation time? Yes,
we can ask.
Yes, during 3 minutes. Can we ask the name of patient at the beginning
of the preparation time in non-case? That I think
which means 3 minutes preparation. Yes,
student meant that in that 3 minute preparation.
You must actually 3 minutes preparation time. You are supposed to ask only 2 things. Can you tell about that?
Name,
and if you don't know, if you didn't understand, not about the task. Okay, if you didn't understand about something about any phrase, any meaning of the particular phrase, you can ask for that. Okay. So fine.
If you are having any doubts regarding any of one of the tasks in that 3 minute preparation, you can ask that.
Okay,
also.
but don't ask them how to perform this task. They won't answer that. Okay, they are not supposed to actually. Okay, so you just ask. If you don't know the meaning of particular word, you can ask for that. Okay, if you forget to ask name in preparation time,
in the non-case, how we will manage.
Okay. Always try to be in the safe zone. During 3 minutes preparation time, you must ask the name of the patient, but sometimes if you forget, okay, but don't try to take that in mind. Okay, you're gonna do the same thing in the entire role play. Okay, as ma'am just given a hint just before, do you have any points to be added on, or should I?
Do not panic. Actually, we can ask the name before the first task. May I know your name, or can you restate your name?
Okay, can you restate your name? That's fine. Okay, but I always prefer don't take any kind of risky elements in your speaking. Try to be in the safe zone. But if you forget, you can go for this. Can you restate your name? Which means already meant that okay, they have stated and you are asking for. Okay, forgetting for the documentation. Can you restate it? Not kind of restate it. Can you restate your name? But it should be in a very polite way of approach. Okay, then
can you tell about how to conclude the role play?
We just go have
mentioned how to manage the time.
Okay, how to manage the time. Actually, yesterday when we are collecting the concerns or questions from the
we got a lot of inquiries regarding the time management.
Okay, so ma'am, let me ask you 2 questions. Okay, and because actually for them, if there are some students, they didn't get enough time to complete. Okay, and there are students, they have actually 2 minutes extra, or there are 2 minutes left in the task, which means within the 3 minutes they're gonna complete the task. For both of them, how can you give some tips for it if they couldn't complete, or if what about the time management?
If the time has stopped, that 5 minutes is over, we can just say thank you, or thank you for the cooperation, and before that we can ask, do you have any other concern? Surely the patient will say no, and we can conclude like thank you for your valuable time and thank you for the cooperation, and we can leave the room. If we are having still 2 or 3 minutes, we can conclude like give an overview about the task. Probably a task is about a diagnosis or the medications, right? So we can tell about the medication in brief.
Okay.
Is that right, ma'am?
Yes, perfectly fine. Okay, so I think that it is clear to you. Okay, if when you are seeing the cue card, it will be clear to you actually whether it is in the time or not. If it is 3 or 4 and very short task, you can understand that it is actually very less task and the time will be balanced. Okay, the time will be left actually when you're doing the role play. Okay, so make that into perfect communication, which means not one way, like perfect two-way communication, like should be kind of interaction itself. Okay, in between each task you just ask follow-up question, allow your patient to communicate. Okay, allow the patient to communicate, be a good listener or operator. Okay, then okay, and if you're feeling again the time is actually left, which means more than 1 minute, okay, just conclude your task so far you discussed, but never say that okay I just want to conclude, never say that. Okay, just give one more reminder to your patient to be followed, which means if you have given any kind of advice or any kind of encouragement of about something, you just can add on. Okay, so Peters, before concluding or before wrapping our conversation, let me tell you one more time, it is really important to follow the advice regarding this exercise, kind of anything, just manage the task which you have performed. Okay, then you can say just when you are concluding, just drag it. If you have the time, just drag the conclusion kind of. Peter, it was a good time to have a communication conversation with you, and I really wish a speedy recovery, and kind of. Okay, so you can plan, you can manage the time. But if there is if it is a very lengthy task, how to do that, ma'am? If it is so lengthy, how can we manage the time?
So do not elaborate the point, and we cannot use the irrelevant sentence here.
Yes,
out of the task.
Yes, what is given, just perform that, don't want to add anything extra. Okay, then you can plan accordingly. Then actually there are a number of questions to be. Okay, here Sneha asked a very detailed question, ma'am. During home visit, we asked the patient, is the right time to talk with you? Okay, and what if they are not willing and if is uninterested to speak? How to handle the situation? First thing, they will not say that it is not the right time. Okay, but if they are telling that it is not the right time to have a conversation, or I'm not interested, how can we manage that, ma'am?
We can tell the doctor has sent me here, or your situation is worsening day by day, so needs to check on your health.
Okay, you just add on, you just go for one more request. It is really important to have a conversation right now for because it's as per doctor's advice, and I will just take only 5 minutes. Can you spend the time for me? Okay, fine. Surely they're gonna agree with you.
We need to reassure the patient there.
Okay, and if the task is only about reassurance and given all the reassurance without dragging, but completed within 3 minutes, and again summarized, still there is 1 minute, will it affect our score? Actually, there will be minimum of 4 tasks. Okay, minimum of 4 tasks, and if you summarized, and it will not happen actually. Maybe there is a problem with the speed. Okay, don't bring the conversation in a very speedy way. Okay, you have mentioned everything was perfect, just give as a pause and a communication. I think that you can manage the time then. Okay, what about
salutation, whether we need to add Mr. or Miss during conversation?
Actually, okay, actually it is not wrong to be added, but there is a high possibility of getting gender change. Okay, because always speaking is not a comfort zone for the students. They're really tensed. Okay, and if we are adding that Mr. and Mrs., there is after that in between the conversation, Mr. will be Miss and Miss will be Mrs. Okay, so for avoiding that, we are telling that don't give any salutation, or you can just tell about the name. Okay, always be in the safe zone. That's it. Okay.
Ma'am, we have a question. If we are talking to the relative of the patient in an unknown case, whose name we have to ask first? In an unknown case,
to whom you are having the conversation, it is nothing but you can ask the both of them. See, if it is unknown, fine, just for the better communication, may I know the name please? That's it. They're gonna tell the name of the particular person whom you are having the conversation. Okay, or if it is a third person, nothing but just ask the name of the person whom you are having the conversation. It is not wrong if you are asking the name of patient, but there is again high possibility of getting that gender change, or you're gonna mislead the, or like you're gonna miss some kind of things in your role play, kind of you're gonna take the patient into the bystander or bystander into the patient, kind of things will be happen later on. Okay, so talking to, okay, how do we know that time up? Okay, still reminding. Okay, so actually there is no any kind of time indicator in our exam, but actually the task is planned accordingly. So like after completing your task, after your like kind of exposure with the speaking, you will get a clear idea. Okay, the time is and surely the response of your patient, if you are listening that very perfectly, the response of your patient or the bystander whom you are having the conversation, from that you will get a hint. Okay, not always. The one thing is that they will not mislead your task. Okay, because they are there to help you to complete your task. Okay, so they always make sure that nothing wrong happen in their side. Okay, so you can plan accordingly by listening them. Okay, if you still have 1 minute remaining, how to fill? Okay, we have already mentioned. Okay, we have already mentioned about it.
Continuous communication.
So there is a number of things. Okay. So, ma'am, would you like to add anything in this before we are wrapping up?
So, if a task is not understandable, how can I tackle it? We got a question from our student.
Okay, how can we tackle that, ma'am?
So, we can say, explain that you do not know whether it is broken, but the procedure is the same for a badly hurt or broken toe. It's an example actually.
So, what you have to do is, as ma'am said, this was a task from the cue card. Yesterday we have taken that. Just exclude the task which is given. Okay, here
I have mentioned explain that.
Okay, so just exclude it, explain, and just read the task. If you didn't get an idea how to do it, what is that about? Okay, just read it. Kind of this. Okay, the task is this: explain that you don't know whether it is broken, but the procedure is the same for whatever it is. Okay, just so and so. You can exclude that. Okay, you can just tell I do not know whether it is broken. Okay, we just cut off this explain and we are reading the next sentence, rest of the sentence. Okay, so this is one of the way of to conclude to perform the task. Okay, if you do not separate, so will also not fine, but actually providing structure, it should have it. Not enough summarizing it. Actually, it is not mandatory. If you complete the task, it is one of the tips to manage the time. Okay,
if we have time.
Okay, task explain done. Okay, ma'am, if
the tasks are unknown or the condition which is to be explained is unknown to us, then how can we handle that to continue the role play? They meant like the condition or the diagnosis.
If the tasks are unknown,
they are not familiar to the task or the condition.
Okay,
how they will manage.
Okay, so the thing is, if you don't know, but something that will be given as a hint in the cue card, surely. Okay, and if you don't know the name, the phrase, actually what that about, you can ask to your interlocutor. But surely, okay, if you don't know about that, you can exclude it, which means whatever you just short write an example. Just exclude that task and read the text of the sentence. I know that, yeah, we clarified almost all the doubt of our students. And one thing I just want to tell, it was very interactive. Lots of students were asking many things, okay, but there are certain things to be answered, but because of the time, we are wrapping our live session now, because yeah, it's almost about the time. Okay, so shall we conclude?
Sure, ma'am.
Okay, so thank you all. Thank you for your participation, and thank you for hiring your questions in the comment box. And if you do have anything more, you can comment that. Surely we will answer it later on. And we wish a good day for everyone. Thank you.
Thank you.